Hi, everyone. Welcome. Thanks so much for joining CADIO's webinar series and happy Friday. Today, we are super excited to be launching something of a new type of webinar in our series. We've been calling it CADIO in Conversation. And the goal of this new series is to highlight exciting emerging new areas in intervention optimization or big topics in optimization that are newly getting attention. So this webinar, unlike some, is going to be approached more as an open discussion and conversation, and we're extremely excited to have some special guests here for this. The conversation will be moderated by Kate Guastafaro, co-director of CADIO. I'm going to begin by introducing our special guests, and then I'll turn this over to Kate. So, first special guest, presented in no particular order, our NYU colleague Jonathan Purtle is a mental health policy researcher and implementation scientist. He is Associate Professor of Public Health Policy and Management at the School of Global Public Health and Director of Policy Research at NYU's Global Center for Implementation Science. Dr. Max Crowley is a prevention scientist investigating how to optimize investments in healthy development. He is Professor of Human Development and Family Studies and Public Policy, Director of the Edna Bennett Pierce Prevention Research Center at Penn State, and Director of the Evidence to Impact Collaborative. Taylor Bishop Scott is a community psychologist who is situated at the intersection of research and policy. She is executive director of research translation in the Evidence to Impact Collaborative at Penn State and co-director of the Research to Policy Collaboration. Huge thanks to all of our special guests for joining us today for this conversation, and I'll turn it over to you, Kate.
Awesome. Yes, I'll just echo how exciting this is to have all of my friends here to have a conversation that at least I've had with Dr. Purtle for going on 4 years now. So I'm really looking forward to kind of taking this up a level. And before I turn it over to our guests, I wanted to kind of level set with two pieces. The first thing, you all know you're here because you are enthusiasts of MOST and intervention optimization. And hopefully you know that in the MOST literature, we use a very specific definition of optimization. However, it is a concept that really transcends disciplines. And sometimes there's different meanings in the word optimize. So I think today you're going to hear a couple different versions of that. And I wanted to just note that to begin with. The second thing that I find very exciting is in the majority of CADIO's webinars, when we're talking about intervention optimization, we are talking about evidence-based interventions and intervention science. Today, I'm asking you to think about the intervention as policy. And so just a little bit different of a take on what we typically talk about. So I'm going to turn it over to Dr. Purtle to walk us through policy and policy research.
So, welcome everybody. Thanks for joining. So first, I just want to give a very broad definition of policy to kick things off. And my definition of policy is there is no one uniform, really widely accepted within any field, let alone across fields, definition of what we're talking about when we're talking about policy. Generally policies need to be written down. I think that's a core criteria. It's something that's written down about how things should proceed moving forward. Scott Burris at Temple has a paper where he defines policy sort of like that, and I like it. When we talk about policy, there are different types of policies. We would think about two broad buckets. We have public policies and we have private sector policies, all of which matter for health. In the public policy domain, we can then split it again. We can think about policies made by elected officials, things like state legislatures and folks in Congress and city councils. And then we can think about administrative policies over in the executive branch of the government. And of course, we can think of policies at multiple levels: city, county, state, and federal. And then we can think about private sector policies that matter a lot as well. So the policies of insurance companies, clinical guidelines set by professional societies, those often work similar to policies and set standards of care and practice and things like that. So in my work, I've always kind of been interested in policy and evidence use in policy and really kind of getting policies to work better. And when I got into this space, I found that implementation science was kind of a useful realm, if you will, or field to ask these sorts of questions. One very pragmatic reason being there has been funding for implementation science through NIH. Implementation science program announcements are not the only place at NIH that you can get this work funded, but it is one place where, the questions related to evidence translation and evidence impact are really central. So colleagues and I wrote a paper just putting out 4 different ways to think about policy and implementation science. And I share this as it might be useful in structuring our conversation a bit. So first, we have these 4 ways, and we can think about them across at least 3 steps in a continuum. We have the processes of policymaking, so social and political and administrative practices and processes through which ideas get proposed, and then policymaking occurs, and then we have policies on the books, and then we have policy implementation, the rollout of those policies on the books, and that's a whole can of worms in and of itself. So these 4 different ways, in this middle bucket here, we can think about policy as a strategy to use, right? And I think that's what Kate was alluding to, like policy as an intervention. We can do that. And also we can think about policy as context to understand. So in number 1, we are trying to, it's often challenging to do and not feasible to do, but sometimes we can. We are manipulating policies on purpose to help achieve outcomes that we care about. More often, policy is fixed, right? And there we can think of policy as context. We just want to understand. We want to account for it, perhaps in our models. We want to bring in measures of policy context and account for those things. We can't randomize people to policies, but let's say if you were doing a intervention trial across different states with different policies, perhaps you could look at interactions between different policies on the books and different intervention components the different sites are randomized to. And maybe that's something that we can talk about a little bit more. Over here, policy is something to implement. Here, we're really focused on the implementation of a policy that's on the books. The policy has been passed. It is very clear, or sometimes not terribly clear, about how things should unfold. And we are studying how it's unfolding and trying to figure out how we can improve the implementation of the policy to really maximize the public health benefits. So here, again, thinking about intervention optimization, we can't randomize places or people to policies most of the time, but we could randomize policy implementers to different implementation support packages. So for example, we have a federal policy that gets rolled out. All states have to implement it. We could randomize states to different packages of implementation strategies focused on that policy and different components across. And then lastly, policy making. So here we think about policy as something we want to see adopted, some sort of evidence-based or evidence-supported policy that, say, has proven to work or demonstrates strong evidence of working in a couple states as documented by, well-designed quasi-experimental studies. We want to see that policy in more states. And we want to figure out how to communicate evidence about that policy to policymakers. So here we are doing policymaker-focused dissemination research to figure out how we can better influence policymaking processes and get better policies on the books that are more aligned with evidence. And I just have one more slide here, thinking about outcomes, and we can talk more about outcomes as we go on. So just here on the policy dissemination side. So here again, we're doing experiments really, trying to figure out how to get better policies on the books. And there are at least 3 levels of outcomes that we can look at. I'm sure Max and Taylor will share thoughts on this as well, and they've done a bunch of this in their work. Most proximally, right, and again, these are experimental studies, we can look at engagement with evidence that we are disseminating, right? So randomize policymakers to get different sorts of messages, different sorts of evidence, and looking at things like email views, link clicks, website visits using Google Analytics, things like that, requests for consultation. So very proximal, necessary, important outcomes, but not really not necessarily sufficient either. The pros here, these are directly deservable outcomes. We don't have to go survey policymakers. It's hard to get good response rates. And the cons, as I said, these are necessary outcomes, but not meaningful in and of themselves. Somebody looked at an email, so what? But that evidence is not going to have any impact on them if they don't consume it and cognitively process it. We can also look at the uses of disseminated evidence in policymaking processes. We can disseminate evidence and then look across study arms to see if that evidence shows up prospectively in the social media posts of legislators randomized to condition A, B, or C at different rates. We can look at the content of bills, again, looking prospectively after we disseminate evidence. Again, the pro here, it's directly observable, no need for surveys, and slightly, arguably, maybe more meaningful because we're actually documenting the use of evidence in policy making processes. There's some methodological cons or considerations. What's the denominator of legislators who are active on social media, like really active, if we're using that outcome? If we're looking at bills, evidence can show up in different ways in bills. Sometimes it shows up in a purely symbolic way. Say the first section of a bill, which is kind of just like a ramble about why this bill is being introduced, why it's important, but nothing in that section is allocating resources or regulating behavior or anything like that. And lastly, policymakers' knowledge and attitudes towards disseminated evidence or the public health issue that that evidence is about. So here we have to go to policymakers and collect primary data, generally through surveys. So we can do this. We've done this in our work, and others have as well, through survey-based experiments, so where we recruit policymakers and their staff. They start taking the survey. They are randomized to the experimental stimulus, which they see on like the third page of the survey. Say that's a policy brief framed a certain way or certain types of evidence presented in it. And then we assess things like knowledge, attitudes, motivations, things like that. The pros are, we're actually, given the experimental design, we can attribute differences across the study arms to this evidence that we're disseminating, to the intervention, which in this case would be a policy brief framed a certain way, which could be important antecedents to meaningful behavior change and policymaking behaviors. The big concern, the big challenge with that sort of work is getting a good response rate, and you get data back, and internal validity, you're good because it's an experiment, but external validity is always the big concern when you have a response rate of 2% or something like that. And we can see significant effects, but how long do they last, right? We are collecting our outcomes data, 1 minute after they view this policy brief. We can see changes. Do those changes last 5 minutes later, half an hour later, days later? We often don't know. So I'm going to stop there and pass the proverbial mic to Max and Taylor.
Thank you, Jonathan, for reviewing the metrics that we also use and rely on in our research. First, wanted to get started with just kind of giving some examples about how we have implemented processes to test interventions that improve policymakers' use of research. In the conceptual diagram that Jonathan just laid out, the policymaking process is a relatively proximal indicator compared to the implementation and some, agency guidelines, for example. But it is one of the best indicators that we have to date to understand how can we improve how policymakers use research. We designed a model called the Research to Policy Collaboration based on decades of theoretical research that showed that relationships between researchers and policymakers matter. And the more that we can improve collaboration and trusted connections and dialogue, we believe that that is an important step in the right direction to improving how policymakers use research evidence. And so this is our original model design. What I want to show today is how we've optimized this model over time through experimentation. So just to walk through what the steps are very briefly, the original model, we identified our policy goals with initial meetings with legislative staff in Congress. And then we built a network of scholars who we communicated with primarily through email to identify their alignment and their match between researchers and policymakers to eventually bring them into rapid response meetings that connected them together. To build their capacity, we provided 1 hour, 6 hours worth of webinars available to them. And we also were encouraging them to write on fact sheets in preparation for these rapid response meetings. And we conducted a second meeting with people in Congress to identify short-term needs so that when we were preparing for Hill Days, that we felt like it was most timely and most relevant and we could know exactly what they were working on at that time. And so ultimately, step 5 brings the communities of interest together. Researchers meet with policymakers who share interests, and that results in our ability to think, well, what can we do with their information? A lot of the responses in this original model involved having researchers as educators and sharing things that they've learned, and their responses included things like, this is the things that I've been reading, and let me send you some resources and some materials to think about. And the idea was supporting ongoing collaboration. And we imagined that by facilitating these connections, that researchers could stay in touch independently on their own. And so we've used some experimentation to be able to test this model in 2018 to 2020. We were able to show effects in how policymakers were using evidence language in their bills and their reported value of using evidence to understand problems. Researchers reported benefits to their scholarship as well. I'm not going to provide a ton of details on our results because I want to focus more on methodology today, and that includes how we optimize the model. I wanted to share another process that's related to what happened with our very interactive model called the Research to Policy Collaboration. It involves lots of handshakes and dialogue. During the pandemic, we had the opportunity to think about how we optimize our processes using virtual interactions, and that built on what we learned and knew already were timely and relevant issues that Congress was working on, but trying to engage researchers in a digital format, converting handshakes into fact sheets and emails and Zoom meetings. And what we were able to do with this process that we have now begun calling scope is that we were able to deploy nearly 100 field experiments that rapidly test how we optimize our engagement between researchers and policymakers. And this included how they were responding to our content via email, just as one example, using this process of experimentation, identifying how we can engage researchers at the right time. We found that a newsletter flopped, and being able to send emails from a real person who just sent a very casual toned email of, I'm the scientist who wrote this thing and I thought you'd find it interesting, did way better. And so we learned a lot through the process. And we've also used this methodology to experiment on practices on the ground. So for example, we found that by dropping off flyers in Congress, it's a lot of labor. We want to make sure that it's a good use of our time to have boots on the ground, but our engagement rates and scheduling skyrocketed, and therefore we were able to demonstrate with our data that it was worth the time to be able to be fully present. One of the most surprising findings we had was that we saw that when we sent a fact sheet to someone in Congress before requesting a follow-up meeting, it actually cannibalized our rapid response rates. And so we have shifted our model to being less synthesis focused and more interactive and quick turnaround focused, just focused on dialogue and quick meetings. And so that's what kind of provided us with some input to optimize the RPC model. And so while this figure looks pretty similar, I would say that the steps are fairly different now. As step 1, instead of having another or a second meeting with the legislative contact, we start by using our resources to identify who are the right policymakers in a given topic area based on the kinds of bills that they're introducing, their committee assignments, and we do a lot of deep homework to understand what their priorities are before even asking for the meeting. And that streamlines the process because we have one fewer meeting for them. It's less participant burden, but is a time saver as well. And so our step 3 is that one and only real needs assessment that we need before bringing a researcher to meet with them. In the research community, we now have a digital platform that allows for researchers to communicate with one another, which was a huge time saver for us organizationally as well, because when you have a lot of emails that are disparate and disconnected that actually produce redundant input, then they're not reconciling their insights across the scientific community. It became a way for us to build consensus in the scientific community around policy issues, as opposed to trying to make sense out of maybe 20 different replies in my email. And so our building network capacity also shifts to much briefer trainings now. So we have 6-minute trainings to prepare researchers for meetings as opposed to 6 hours. And it's a huge difference in terms of time commitment for participating in the network. And our goals now include a quicker turnaround to bringing researchers to match with the legislators who we've done the needs assessment with. And that means also streamlining our upfront work on doing research synthesis. Instead, what we want to do is use research synthesis as a tool for collaboration and partnership, and not as a tool to allow us to be ready for that meeting. And we have created stronger pitches and strategy guides for our policy associates who are trained and certified in implementing the model, so that we're not merely talking heads at meetings who are providing mountains of papers as a result of our meeting with lawmakers, but instead are thinking about who are the target audiences of the policymaker and aligning our responses in ways that are a strategic partnership benefit to the office, as opposed to playing a purely educational role, thinking about how we partner with them in ways that help them to address their problems. And so that is a deeper level strategy than I think we were doing originally. And that allows us to build that relationship over time. So that's visualized now with an arrow, because we view this as a feedback loop. Relationships are not an endpoint, they're a process. And so now I'm going to hand it off to Max to tell us more about what we found.
Thanks. Appreciate it, Taylor. We, as you can see, we've covered a lot of ground in the last 7 or 8 years, and sort of to put it in perspective from our optimization journey, if you will, while not maybe perfectly aligned with maybe the most framework, I think there's a lot of elements of it that are an homage to what CADIO and the folks, Linda, Kate, Jillian, where your leadership has been in the field. In particular, so what Taylor described here in the first evaluation was we ran a pilot study, and then ultimately we ran a larger randomized controlled trial of over 90 members of Congress. We found that we could, in fact, at scale in an experimental randomized design, find an effect not only on the survey outcomes from those offices around their use of research in their policymaking, like Jonathan was mentioning earlier, but also in the bills themselves, right? We saw a statistically significant change in the bills being introduced by Congress by congressional offices. So from there, Taylor described the scope model, which was really going into the guts. And Taylor and team did this amazing kind of effort of, as you heard, over 100 different micro trials looking at everything from how we communicate through digital forums, through like how we kind of have boots on the ground. And all of that led to a growth in terms of our understanding of how we could optimize the model, which we then tested in a second randomized control trial of the US Congress, where this time we compared our 1.0 to our 2.0 version. But a lot of these sort of innovations that Taylor described in that intermediary optimization period gave us this ability to create this now transformed model. One of the things that we did is, so one of our key outcomes is, can we change the bills being introduced into Congress, right? And what we did was look at not only though how could we increase the effectiveness, but also the overall cost effectiveness. As you might imagine, this work can be incredibly resource intensive, and to do it at scale and to do it sustainably requires a conversation around not only potency, but also the cost side of the equation. So in that second trial, we conducted a cost effectiveness evaluation on top of the randomization, and that allowed us to look at how those innovations and efficiencies on both how we engage with policy communities, but also really key, how we engage with researchers changed the resources that were needed on the ground. So as Taylor mentioned, for instance, one less meeting, right, for both the researchers and the policymakers, or the savings in terms of training time, right? These are real, tangible kind of savings, both for the key constituencies, policymakers and researchers, but also for the staff. And what we found was that we were able to reduce the cost to produce or to support the production of a new bill to Congress that used scientific evidence by over 40% through this optimization. And what that looks like is that not is the ability to serve more offices, right? And support more bill making and more policy making efforts through that. And so that's been kind of the journey, in that in order for this to be something that's sustained, that goes to scale, that can work not only in the US Congress, but in other spaces, we needed to have an efficiency conversation around within the optimization kind of goal. So that leads to where we are today, which is the ability to create that efficiency was essential because, Congress is big and looms large in our minds, especially these days. But it also is actually relatively small, right? There's only so many policymakers that one can work with. One of the next stages, one of the great elements of the U.S. democracy is the states, right? And what happens in the states, and the ability to you've probably heard the term, right? States as the labs of democracy, and we really sought to put that to the test. So that led to some new studies, including first a proposal that was accepted and funded by the National Institute on Drug Abuse to understand how we can support substance use prevention in state legislatures. But in this context, we weren't randomizing at the level of the individual congressional office or legislative office. We randomized at the entire legislative body. So we have a trial of 30 state legislatures, the entire legislative body, where half are receiving the supports of this now, this more optimized and also more cost-effective and efficient research to policy collaboration model. And then half of the legislatures that are not. And as you might imagine, that leads to all kinds of interesting opportunities for testing and evaluation. It also leads to much more power, right, statistically, in terms of what we can do and what we can think of in terms of how we engage on the ground, right? We're moving from, about 96 congressional offices to 300 legislative offices, for instance, within this trial, of course, within a nested structure. And so really exciting and a lot of opportunities to do that work. Some of our preliminary findings have found that we've been able to increase the use of research evidence in state bills that are introduced by over 20%. In the first year, that's nearly 70 bills that included and used scientific evidence around substance use prevention that did not, or that would not have included that based on the experimentation at least. As a result, or in that context, we've also been able to expand to other substantive areas. So, for instance, the National Institute on Child Health and Human Development has funded an analogous 30-state randomized control trial around child maltreatment. Beyond that, the tools and the platforms that Taylor has described, in particular, the digital platform for when we ingest or when we receive requests for scientific evidence from a legislative office, that now goes into a digital community of trained and categorized researchers from around the country, hundreds and hundreds of researchers in different substantive domains. And we're able to actually pipe those requests directly to the specific researchers who have the specific expertise, crowdsource the responses, and then be able to turn those around. But that platform itself, as Kate and I had the opportunity to talk at a scientific meeting about recently, also provides a platform for experimentation and potentially optimization, right? Because as we know, within digital spaces, it's a lot easier to engage in more elegant and complex optimization designs. And so that for us is something that we've begun doing work. Some of what Taylor had mentioned earlier in our earlier platform was able to do some of that testing. Taylor recently led a really nice paper in development of psychopathology about that work in optimizing the researcher experience. We also like to experiment with researchers because in many ways, they are the active ingredients, right, that we would describe in a regular behavioral intervention. Because if we can't get the researchers to show up with bells on, if they're not ready to go, if they don't have the capacity, if they don't have the sort of hand-holding that needs to happen, then we can't do any of this. And so as we think about the active ingredients and how we optimize further for the future, we know that part of that lies recognize in the research community itself. All right, so Kate, I'm going to pause there because I want to make sure we have plenty of time for the questions. But
Awesome.
Taylor, hopefully I didn't miss anything.
Well, I am one of the people that you experimentally manipulate, and I know that, and or I was at one point. Thank you both for walking us through your genuine enterprise here, and it's really cool to see how much it's evolved and changed. So, the plan moving forward for the rest of the webinar here is we've got some discussion questions that I'm going to pose to our panelists, but we're very interested in the rest of our audience engaging in this conversation as well. So please feel free to raise your hand or ask questions or contribute to the thoughts. So here we go. Our first question, we've heard a lot about this actually from Max and Taylor already, but when we think about the randomization and experimentation, Max, you reviewed how you've randomized at the Congress level and then local legislative and things like that. Any more details about your randomization setup that would be maybe helpful to talk through?
Sure. I'll just add, I guess, technical, more technical stuff. We did a messaging experiment with state legislatures back in 2021 or so. So it was a three-arm messaging trial, cluster randomized. So we randomized states, and it was stratified block randomization. So pretty much what we were trying to achieve was some degree of balance across study arms in the number of individual legislators in every study arm, because legislatures vary tremendously in the number of legislatures vary tremendously in the number of legislators. So there's, close to 400 in New Hampshire, and I think it's like 50 in Nebraska. So we block randomized to try to have the same equivalent-ish number of legislators in each arm, and also stratified to try to have a similar number, similar proportion of the state legislature be registered as a Democrat. So we had diversity in political party affiliation across the study arms. And it shakes out how it shakes out. But those were two variables we were trying to approximate some degree of equivalence on across the three different arms of the experiment.
Great. Okay. So related to this, can we have maybe like a discussion, and just to context here, right? If we're thinking about intervention optimization as the most world, right? And we're talking specifically about a factorial experiment, randomizing whatever our unit is to all of these different possible experimental conditions. I'm wondering if in that context, given the work on policy, you all could think a little bit about some advantages of randomization and what the drawbacks would be at that in that kind of purview. Go ahead, Max.
Yeah. So when we did the first trial, we had a straight control group, right? Treatment as usual is what we called it, right? Which is they weren't prohibited from engaging with researchers, of course, but we weren't helping them. And boy, was that painful to have, congressional offices asking you to help with a piece of legislation that was, could potentially really benefit people's lives. And we were actually experimentally prohibited from engaging on that. So I just have to pay a little bit of, lip service to the psychological trauma that I think Taylor and I are probably still both wearing from that. But in the second trial, we were a 1.0 versus 2.0, and that was a lot better from the standpoint of we weren't missing things, but boy, was contamination a concern, right? And we made it through, but it was only through, honestly, Taylor and her team's leadership in really thinking strategically about how to be thoughtful about that. Now we're engaging, as Jonathan, I think, was mentioning, in more cluster-based randomization. So we don't worry as much about contamination within legislatures now or between legislators, but there's all of the idiosyncrasies of balance in those spaces. So I think like those are some of the logistic difficulties of it. But I think that as Taylor so rightfully mentioned, like there has been so little experimentation historically in this space, while there's been so much policy analysis, and the opportunity to inject even a little bit of kind of stronger causal inference through this work using some of these additional, experimental methodologies, we have found has really helped facilitate the conversation in the field.
Max, I think you really hit the nail on the head with like how messy it was and how hard it was to do this experiment in Congress. And that's why we've been so relieved and excited to do this work in the states, because with our group clustered trial, either the state is receiving contacts with researchers or it's not. And it creates a lot less gray area for, in Congress. I remember one of our rapid response meetings had the target audience was there and invited her colleague to join, and they were in the control group. And everybody's like, what do we do? And I'm like, well, it is what it is. It's just going to diminish our ability to detect an effect. So the fact that we were able to detect an effect is actually in some ways a bit surprising. And we are hoping that we will have more power to detect more contextual types of dynamics in the states as well, because they're all these unique ecosystems. Another advantage that I wanted to raise is the fact that these field experiments sometimes shed light on things that are surprising and unexpected. And sometimes our field experiments are null, like that's going to happen, right? Like we really thought that this is the way that we are going to engage someone and it's going to be effective. And then we're like, oh, sad, it didn't work the way we thought it would. And we were drawing on a lot of theory, including social psychology, about things that persuasion tactics, for example. We knew that persuasion tactics are something that a lot of us are trained on in terms of sort of drawing on group norms or trying to do calls to action. And what we found is a lot of those tactics actually failed us. If anything, sometimes they backfired. One example of that was that we used a narrative of people who were survivors of drug addiction to show that like this advocacy organization compiled all this narrative of people who've actually lived experience with this. And the researcher said, this is what I study, here's a brief on it, and here's lived experience to couple with it. And it backfired. And we were like, oh, well, that's not what we expected, right? And I think that even an example I gave earlier of trying to show that, we thought that if we could demonstrate our value through a fact sheet sooner, that it would get better results in getting quicker meetings with our counterparts in Congress, but it didn't. It backfired. And so we make a lot of assumptions in policy practice about what's going to work and what's not. A third example was that we sent thank you notes. Very common practice, very nice thing to do. It fits the relational theory. We sent thank you notes, and it did work. It did improve our success rates, but we saw that the click rates of what we sent them in the thank you note were abysmal. We're like, maybe we don't have to spend so much time on the thank you notes. And so the things that surprise us in the experimentation really challenge us to work smarter, not harder, and really improve the value proposition for both researchers and policymakers we're working with.
I just want to jump in to say, I hope that our longtime listeners who are, longtime intervention and optimization enthusiasts are hearing Max and Taylor talk about constraints, the different levels, the components that they're manipulating. It's just that they're talking about it in a different way, right? And so, Taylor, your point about the time that you put into a thank you card, that translates really quickly in my mind to that being a factor that I'm going to manipulate. And it's like a visual thank you that really has no meat versus a lot more thought and resources, right? So I just want to kind of like translate that for the audience to make sure we're all on the same page. This excites me to no end. And Max and I had a really long conversation earlier this year about it. And so that's why we're here today. Can I ask about, or could we take one step back? And Jonathan, you and I have spoken about this. could we think of like policy and randomization and designing an experiment kind of at like a lower stakes level? So, for example, the idea of using or how medical insurance has now covered the continuous glucose monitors, right? And like, Jonathan, that's written down. So can I identify that as a policy?
Yeah, sure.
Okay.
Yes. Yes, you could. Do you want me to say more? Just want me to keep going with that?
Well, what if, sorry, this is like
Go.
completely in my head. What
Yeah.
if one of the factors that somebody in intervention optimization working in the space wants to do is manipulate whether or not like they're communicating that insurance covers this versus not. And the other factors that they might be exploring are less about policy. Could you like one, follow my train of thought, and two, talk about like maybe some of those thoughts about how one factor about policy and then another factor about like an individual behavior change and monitoring, any kind of thinking about the actually designing of that and implementing it and the complications?
Yeah, so I mean, I think it's a good example, right? So there is everyone in the US is exposed to this policy change, let's just say, right? And you could cluster randomize states to different sorts of implementation strategies, which would be the intervention or different bundles, right? Optimize different components. One could be, right, like a communication focused intervention implementation strategy component where you're communicating, let's just say you have the money to do, public marketing and letting people know that, hey, insurance covers this now. And then another state, you could have that. Plus, let's say, you partner with some large health systems and you are educating physicians and nurses and people that interface with patients who would be eligible for this about the policy change. And you could have, a multi-component, what I would think of as an implementation strategy for a evidence-based policy. And your outcomes would be things like, right, the remote glucose monitoring rates as your outcome, say at the state level. In an ideal world, something like that would be, I would say, yeah, you'd be experimenting with policy implementation strategies. Um, yeah, and there'd be logistical challenges throughout, but that would be potentially feasible, for sure.
Cool.
I guess I will say the one thing when I was going to say this, thinking about this slide about drawbacks of randomization, thinking about policy implementation, you have a federal policy, this idea of randomizing states to different implementation strategies. Oftentimes, if the policy is a big deal, there's a few niche people in every state that like that's really on their plate. And they talk to each other. There's some professional organization that convenes these very niche people, and they all kind of, support each other and troubleshoot together and they talk. So there is this like contamination part. Even if you cluster randomized states, it's around implementation of federal policy. There's a good likelihood most of those folks are going to get together on a Zoom once a month and talk about what they're learning, what's not. I don't have a solution to that, but it's something that I've thought about when kind of conceptualizing this work.
I think
I
that's
did. Yeah, go
Sorry,
ahead, Taylor.
Ruben. I think that's why it's so important to randomize by state. So I didn't explain the full study with the scope trial. We also randomized state legislators to either receive the fact sheets or not. And what we found is, in retrospect, we should have done a state level randomization because the co-sponsor rates of bills and during the pandemic were so high, so interdependent, they work together that we weren't able to detect effects in a reasonable fashion. I think the co-sponsorship rate was like close to 60 or 70%. And so that means that it's no longer an individual level behavior. It's a behavior of the legislature as a whole, as a collective. And so even those niche groups, even if they're outside the legislature, they're still feeding information to the legislature and they're influencing it, typically one ecosystem at a time.
Yeah.
Yeah. I think, Taylor, the points you're raising about contamination, complications with randomization, and even the points that you were raising earlier about how when you have tried strategies that are theory informed and you're like, this is really going to work, and then your studies show that it doesn't, I'm looking at the attendees in this audience today, and I know that they can resonate with that, right? Like it's very often in the case of intervention optimization where we use a factorial experiment based on really solid theory that we don't have the findings that we thought we did. So I hear Linda in my head like, well, that's true of any experiment. Like, so all right, this is great. I'm gonna move us past randomization here. And so I this is inspired a lot by a conversation with Max, but open to Taylor, Jonathan, you as well. Thinking about the intervention optimization paradigm that you know well from us, could you talk a little bit about the barriers that you see in applying specifically that to policy related research questions? Not in like a you should never do this kind of way, but things for us to think about.
Yeah, no, definitely. I mean, I think that um, as has been mentioned, up until this point, like this area is messy, right? One, because even experimentation is a relatively new kind of area of work in this space, and it's very hard to find even the points of experimentation, right? This is a field of inquiry that at best has found natural experiments along the way, and those instruments are often not so robust, right? We find, and so the experimental work is in itself new, but instead of waiting for the field to take, 40 years to move from, running our basic RCTs, like two-arm RCTs, to like, really going into optimization, like I think there's a lot that can be done. And I would say that some of the barriers are how covert some of the behavior is, how few actual individuals to intervene with are, right? Like in reality. And so from that earlier conversation we just had, like one of my dreams is to do this work, for instance, at higher levels, like we've been talking about, like what would this look like in the European Parliament, for instance, so at a transnational level, but also at the much more local level. So what would this look like with school boards, right? Because then we have the power to do a lot more. We also need the efficiency to be able to operate at that level. And hat tip to Elizabeth Day and Adam Levine, who've been doing really thoughtful local level experimental work. And I know there's a question in the chat about where can early career folks get involved. And I think there's a lot of opportunity at those levels, at the local level, to do to think about where this fits into your career, because there are more people to intervene. So I think that's the first kind of element of it. But this issue of the covertness of the behavior, so Jonathan just alluded to, like they get together and they have a closed door conversation and they strategize, right? And the reality is like that holds true to the translation of research, right, from between researchers and policymakers, is those are closed door meetings, right? They require trust. They require kind of an expectation of that you're not going to go out and shame a researcher for asking a legitimate question, right? And it's hard. I mean, you're not going to shame a policymaker for asking a very legitimate question, or vice versa, right? And so that trust gap that exists both within the policy community, but between the policy and research communities is another one that like we often lament. And one of the ways that we've sought to kind of move it from a more covert to a more overt behavior is things like the platform that Taylor described, right, where we can ingest, right, the request, and then we can observe in a very qualitative and quantitative processes, right, of what's happening, right? How do we ferment, the kind of response to a request for evidence? And one thing that Taylor and I forgot or didn't mention was the amazing work that Catherine Oliver and Shannon Gillier-Wright did through an independent ethnography of our first congressional trial, where they came behind us and interviewed both on the policy and the researcher side, and how invaluable that qualitative information was for helping us formulate some of the hypotheses that led to some of the more quantitative experimentation and evaluation. So I'll pause there because I know Taylor's probably got stuff, and Jonathan, I know we've talked about this too. So.
Thank you. I was thinking about maybe another side of the coin is about the strain that we caused our implementation team in trying to challenge our own routines and processes was very hard. So the data collection is hard because it's hard to collect this kind of data. And it also strains us, not just because now we're sometimes chasing data more than we're chasing impact, but it's also hard on the optimization because now we're implementing two different processes that really breaks everything you set up a month ago. Sorry, now we're going to do it differently, but only for half the group. And so that can be very challenging in terms of helping to not just design, like this is the idea that we have for changing things and challenging, does this work or does this not, but also to implement that in two different ways at the same time within the constraints of one study and one relatively modest sized team where you have to have people juggle two different protocols and be able to communicate, this is the one that gets this and this one doesn't. Don't contaminate the control group. And so like the level of like I'm just very thankful for the team that we have that cares as much about the science of science as we do, because there's a lot of persnickety detail that goes into being able to implement two different protocols with fidelity to make sure that we're learning something.
Totally. And I hope that all of our folks are like, yeah, try 16. But um okay. In the interest of time, I think this was a very generative conversation, and the purview and the hope of this kind of format is that this is an emerging thing that CADIO is interested in, and we hope that there are more opportunities for conversation and putting forward kind of like suggestions and guidance for this. To Kyle's question about training, I think Max and Taylor have offered some relationship and how to build those things, but Jonathan, I wanted to give you 30 seconds to talk about the training that you run.
Sure, and I should have a link on hand, but I don't. I'll dig it up. So, this year in 2026, January 20th and 21st, I believe, we're into our fourth annual two-day training in policy-focused implementation science. Taylor, Max, and folks from their team have been very gracious with their time and have been presenters on that the past few years. Pretty much, it's a deep dive for anybody who's kind of dabbling in the implementation science space and wants to integrate policy more into their work. It is about 25 different speakers from across the country and globally doing this work with an implementation science hat on, but also people from political science, public administration research, who would not identify necessarily as implementation scientists, but doing highly relevant, really exciting work related to evidence to impact, and also methodologically doing some cool work.
And Kyle, you should do that. So we will definitely be sure to share that training via CADIO's different venues. And unfortunately, Matthew Lee just asked a really poignant question, but we have only 2 minutes left. And I want to just thank and take the time to thank Taylor, Max, Jonathan for being here and starting this thinking. And I am really looking forward to talking more with you and our audience. And Jillian, if you want to close us out, tell us what's coming next.
We have another webinar coming up next week, I believe, and hope that you will join us for that. I just want to issue my thanks as well to Dr. Scott, Dr. Crowley, Dr. Purtle, Dr. Guastafaro for guiding us through this really interesting conversation. And yeah, so appreciate everyone's time and attention.
And thanks for
Thanks for
trying
the
out the new
opportunity.
format with us.